Hello, I'm Dr. Bruce Shannahoff. I'm the Clinic Director at Valley Spinal Decompression Center in Encino, California. And we specialize in non-surgical spinal decompression. And this 2-minute video is for my fellow doctors, doctors only really, just because this is very technical stuff and really only pertains to the practice of non-surgical spinal decompression. And what I want to tell the doctors is do not be afraid to break the rules, because we're instructed that at certain levels of the spine, if there's a herniation, we pull at a certain angle to try and restore that, and most of the time that works. But when you run into a difficult case and it isn't responding to the angles that you were told it should work at, try other angles. And here is a great example here of a patient of ours who was suffering with an 11 millimeter extruded disc at L5-S1, and he was failing to respond at the normal pulling angles. And we tried pulling him at a very high angle, a 25-degree angle, which would normally be for L1, L2. And he suddenly turned around, things went great, and he was doing better. We surmise that it was the assistance of the posterior longitudinal ligament as the spine was being pulled into more of a kyphosis instead of the normal lordosis that was actually assisting the vacuum effect of decompression in pulling that extruded portion of the disc back into place. And as they say, the proof of the pudding is in the eating. Well, the proof of the decompression is in the post-MRI. And here you can see on the post-MRI of this patient that that 11 millimeter extrusion has been reduced to about a 1, maybe 2 millimeter bulge with a complete resolution of all the symptoms that the patient was suffering with. So again, be willing to experiment, break the rules. Your patient's outcome is dependent upon it. Thank you very much.